Good afternoon. My name is Frank. I will be discussing my third week discussion in our bioethics course. This discussion is in regards to the case study 4D, the process of discernment. The process of discernment has 6 different sections. The first being to gather the information of the case. The second is to identify the ethical issues that are presented. Third is to consider what right relationships require and what leads ultimately to human flourishing. The fourth is to brainstorm possible options. The fifth is to weigh options and select which one is the most beneficial or correct in regards to ethics. And then finally, our sixth, to evaluate the decision against external and internal criteria. In this specific case, the relevant factual information is that there is a 41-year-old woman named Stacy. She is currently at 15 weeks of a pregnancy and has learned that there are potential fetal health threats. Her physician had informed her that the fetus was diagnosed with anencephaly, where the fetus will not be able to talk or think at all, and will have at least the access to control bodily functions such as breathing, heartbeat, and sucking reflexes. And if it is delivered, it will most likely die within a week. Physician suggests terminating the baby instead of carrying the term, and has warned Stacy of the psychological burden that is a potential side effect to seeing the baby born and dying within that week. In this scenario, there are two polar opposites in regards to ethical issues. One being pro-life. Is the fetus considered a human, or is the mother at risk for long-term psychological or physiological damage? These two things are stuff to be considered in regards to someone's life. And then pro-choice being, does Stacy or the mother have the right to decide what is best in this situation? The next part of this process is to consider what right relationships require and what leads ultimately to human flourishing. In this scenario, there are a few groups of identities: the doctor, the nurses, and the mother herself. And what is at question is who exhibits respect, honesty, courage, and integrity. In regards to the doctor, is there information bias? They are a doctor. They are providing this factual information to the mother about her situation, and in doing so, gives the options of what she should do. The doctor had considered that she terminated the baby instead of carrying the term out. And this may seem biased. It may be from past information from other patients who had experienced similar scenarios. The doctor should have an experience of healthy pregnancies, life and death risks within pregnancies, or health complications of the baby or the mother herself. So outweighing these benefits and problems is something that the doctor should be doing with the mother to help her make the right decision. But should it be biased? In regards to the nurses, are their opinions necessary? Is it appropriate to voice them? The nurses had two different types of point of views. One being that the doctor was wrong for suggesting to terminate the baby and not carry out the term, whereas the other group of nurses thought that it would be best that the mother made her choice and perhaps terminate the baby before delivery. Regardless of the two identities that the mother is hearing from, if the nurses had voiced that opinion or not, the mother should, the question for the mother is, does she need to listen to others, or should she make her own choices? This is something that would be big for a mother to decide. So it could clearly be something difficult for them to make that choice. And listening to different opinions could potentially make it a little bit more difficult. When brainstorming some possible options, there are two polar ones in regards to the ethical issues. As you can see here, number one is to continue with pregnancy and the delivery. And then in number three, to terminate the fetus at the 15th week of pregnancy, where she had discovered this information of her infant. And then number two is to outweigh the pros and cons with her loved ones, further discuss the situation with the physician, and consider her own personal beliefs in regards to this scenario. What ethics does she align with most? When weighing out these options, there needs to be one that is selected. The number two, pros and cons with self and loved ones, is something that potentially just helps her decide between options 1 and 3, one being to continue with that pregnancy or delivery, and number 3 being to terminate the fetus at that 15-week mark. Continuing that pregnancy could help her in terms of alignment. This would stand up with the church and the scripture of the church, potentially the laws, depending on what state or country she lives in. And then in number 3, terminating the fetus at this point could potentially reduce the burden that she would experience if she carries out this pregnancy and witnesses the death of her fetus. So it's a difficult decision to make between the two options. Evaluating the decision against external and internal criteria is something that is important because they both play a big role on our subconscious and our psyche, long-term and short-term. Externally, the questions are, does the scripture and church value align with the mother's decision? And are the laws in favor of her decision? I said, depending on what she decides, if she had decided pro-life, then she would be carrying out this pregnancy, delivering the baby, and giving an option, giving a chance to the baby to see what really comes out of this situation. And this is something that would align with the scripture and church's values and principles. Are the laws in favor of her decision? Well, that depends on where she's located. Some places are strictly no abortions whatsoever. Some places there is special criterias, including you need a 24-hour window from when you discovered any complications of the pregnancy before you can decide if you can even have an abortion. You need to wait 24 hours in some places. Some places require you to have proof that you had discussed the abortion prior to it with your significant other, your husband, I'm sorry. And if you're a minor, to have consent from one of your parents. So the laws, it depends on where she's located. So it could be aligning with her, it may not be. Internally, can the mother be free of psychological or physiological damage? And is it within her own alignment to make this choice? Depending on what the mother decides, if she were to have the baby, she could experience a psychological damage from the burden of losing the child after giving birth. And depending on her own alignment, if she were to decide pro-choice and have this abortion, is this something that she could live with for the rest of her life? Is this something that would stick to her, be a burden for the rest of her life? So in both scenarios, she can still have this burden, and it really ultimately plays out on what her belief system and spiritual, social values are. After reviewing this case study, I had a reflection on the scenario, and I had thought if I were put in the mother's situation, my decision would fall under my social and economical status. My significant other's opinion would lay heavily on my decision. I believe that it is not in my case because I am a male, my choice. So to be put into the perspective of the mother is a bit difficult, but as a husband or the significant other of someone having a baby, and that baby becoming diagnosed with this condition where they would ultimately die within a week after birth, I would let the mother have that decision regardless. Um, and whatever decision I would make, I would try to be as unbiased as possible, express how I feel, but ultimately giving her the open field to decide for herself. Uh, what is more important, her physiological response to witnessing the baby die, or terminating the fetus before delivery? Which option would benefit her well-being? Will she want to try again? So as I said before, it depends on the person themselves if trying, regardless of the potential diagnosis and ultimate ending in this situation, is that worth her mental? Is she going to suffer from this, from witnessing the baby die, or is she going to suffer even more? Is she going to suffer even more for terminating the fetus beforehand and not knowing if she had, you know, if she had given that option, that chance to the baby, would that baby had survived? Would it had given her any enlightenment, any purpose in life? It's hard to decide. And ultimately, it's something that needs to be decided in those moments. And then, will she want to try again? That was something that I started to think about. Would you, as a person who is trying to have a baby, try again after witnessing a traumatic experience where you are 15 weeks in, roughly about halfway through your pregnancy, and then learning that it is ultimately going to die? Would you want to see this through again in a different, trying again to become pregnant again and seeing if this is something worth trying, like I said? Ultimately, I would say, depending if I have the economical status for this, could I afford the NICU? Could I afford trying to get this baby in good shape? Is it worth trying if the baby will ultimately die within the week? Is that going to put me and my family in a situation where we can't even take care of ourselves? If we can take care of ourselves, are we psychologically damaged at this point? Is there any PTSD or scarring occurring from the scenario? And is that going to make me decide to try again or to give up on having a baby forever or for a long period of time? Thank you very much. My resources were, my one resource was from the textbook for the class, the healthcare ethics. And thank you very much.